Hello, welcome to Bring a Smile's new podcast. This will be a non video podcast that we'll keep bringing once in a while to discuss different aspects about life and how mental health takes a toll on it. On a daily basis, we deal with a lot of stress, a lot of worries, a lot of burden, and it definitely takes a toll on us. Maybe that's why we realize that having a psychological help, is not a bad thing. It's something that we actually want, or to be very honest, a lot of people actually crave about. And perhaps that's why Bring a Smile and a lot of other people are coming up into this social media platform and discussing about different aspects of mental health problems. Something can be as simple as feeling sad on a daily basis for a few hours, for the entire day, and that can even stretch out to being upset for the entire week and even months. So, where exactly do we stand when we talk about mental health issues, and to whom should we actually talk about this? All of that and much more is going to come here. Today, when we talk about mental health issues, the first thing that someone will always assume, will always conclude to, is that, do you mean that I should go and talk to a therapist? I mean, it can help you, but how do they even help you? Unless and until you actually know about what exactly should happen inside a therapist's room, or when you are on a call with a therapist, or a okay, I'll take a pause here. When I say therapist, I actually mean a lot. A therapist is someone who is going to help you with your problems, and that can be either a psychiatrist, a counseling psychologist, or a counselor, or they can even be a clinical psychologist. So, wherever you go and you talk to a therapist, please make sure that they don't have their own methods. I mean, it's a good thing that they have their own methods which give good results, but you should know what their method is, because you could not and you should not pay a person to talk to you and believing them blindly. A therapist is not supposed to be like that. When you talk to a therapist, when you continue with the conversation on a weekly basis, you need to make sure that your words, that whatever you are saying, whatever you are trying to communicate to them about your personal problems, which actually alter the way you work, you function on a daily basis. And if that's really important, I think your therapist is going to understand that. So, whenever we talk about these problems, when we talk about these issues, the therapist should resonate in a proper manner, and by resonate, they should actually talk about what they understand from what you are saying. Today I am actually going to speak about this because that is the most important thing that needs to be acknowledged here. A lot of people, they go to a therapist, they go to a psychologist, and they keep speaking. Sometimes when the psychologist provides them feedback on what they've understood, they think that the person is trying to intimidate me or trying to weigh down the entire conversation or dominate the conversation. But that's not the case. A psychologist is a trained professional, and if they are taking some time within that hour with which you are talking to them, I think you should listen to them a little bit and try to understand what they are also trying to say. This not only helps you to understand what is their perspective, but also creates a proper bridge between the communication that you have. Whether or not you are speaking the right things, whether or not they are understanding the right things, and whatever they are saying, whatever feedback you are getting from them, whether or not that makes sense to you, you think that yes, this is exactly what is going on. So a proper communication is necessary, and whether or not you do like it or the otherwise, make sure that you at least listen to them first. If you don't, you have the command, you are the pilot of this entire plane, and it's up to you whether you want to continue or you don't. So your comfort level is obviously at the topmost priority, but that does not mean that you should not be able to dominate the entire conversation or try to make the person listen to you throughout. If they don't provide you feedback, how will you know exactly if there is an improvement, if there is something which probably is the reason behind what exactly is going on with your life, going on with your mental health? So a few pointers. First thing, when you go to a therapist, since you are paying them, that does not mean, or that does not entitle, that they need to quietly listen to everything and give you a yes sir response. They are trained, qualified people who are actually understanding your problem on a deeper level, and if they do get an understanding of what's going wrong, they should speak it out. And if they are speaking it out, which means that there is some sort of an understanding that is being established. Second thing that I'd like to focus on is whether or not you like it, whatever they say, probably, I'm not saying 100% true, but yeah, there is a high possibility that they might be right. A therapist should listen to you, should give feedback which is accordingly correct, and in the same time, it should keep you entitled to the fact that you have the command, you have the control over the conversation, and that's why whatever they say, if you don't feel comfortable within that setup, within that setting, within that counselor's office, it's not going to work out. The last thing that I'll speak about today before saying is, don't expect that things are going to work out or things are going to show an impact very soon. It sometimes takes a little time, it sometimes takes a long time, because every person is different and their problems are different. What might be a huge problem to me must be a very small problem to you, and vice versa. Every person's problem has a different magnitude, and that magnitude is subjective to the person who is listening to. So it might take time. So you are paying them. Obviously, whatever they say, it needs to have some sort of a background. Whatever, if a psychiatrist is being consulted here, if they are giving you a prescription, they should justify why they are giving you these medications, what exactly do they think is going on, and how will the medication help you with it. If a counselor is telling you to do something which is a therapeutic hobby, therapeutic activity, you should know what can be the outcome of this. Maybe that can motivate you to give your 100% into the activity as well. So with this, I'd like to conclude that Bring a Smile on a daily basis is going to help you out. We are still listening, we are always, and nowadays we get a lot of calls asking us, why should we trust you? I mean, yes, why should you trust us? And since we are able to justify why, that is, we are confidential, we really want to help you out. We are not charging you, because for us the money is not the point here. And most importantly, when we do listen to you, we listen to you with our whole heart. You are our 100% commitment. We are asking you for a fixed number of sessions, and those fixed number of sessions is something that we understand in the first two sessions, after which we tell you that this is the number of sessions that we want from you. And based on that particular factor, we promise you that there's nothing more than a smile on your face, a genuine smile on your face that we want in return. Please stay tuned to this particular podcast, because we will be talking about a lot more in the coming few days. On a daily basis, we will be helping you out, and on a regular basis, we will be throwing in a few podcasts that can help you in understanding what exactly should be the right way to deal with your mental health issues. Thank you so much. Have a wonderful day and keep smiling.